At Fear Free, we're very excited to support the ASPCA's approach to telemedicine and legislative review. Our mission at Fear Free is to prevent and alleviate fear, anxiety, and stress in pets and educate those who care for them. Telemedicine and telehealth appointments provide an opportunity to give veterinary care to patients in a more relaxed and comfortable environment, as well as allowing pet owners to be less stressed since they can request and receive veterinary care on demand. There's a lot of misconception and misunderstanding about the current state of veterinary legislature surrounding telemedicine and telehealth. So I'm excited to introduce our friends at the ASPCA to help us decipher not only the benefits of telemedicine and telehealth, but also provide some up-to-date information on current legislature and provide us with tangible ways to get involved. We're very excited to have the team from the ASPCA join us today to share their knowledge surrounding this issue. I'd like to pass this over to Dr. DiClementi, who's going to introduce the ASPCA team and begin our presentation.
Thank you so much, and very grateful for Fear Free to bringing us all together. And you'll be hearing from all of us at the ASPCA. I'm Dr. Camille DiClementi, and I work in our ASPC Animal Hospital. You'll also hear from Jen, Brittany, and Amy, who are part of our government relations team, and we hope to have a fun, enjoyable session today. So thank you for joining us. On our first slide here is a painting from 1903, which is hard for me to believe when I take a look at that painting. It looks very relevant. The painting is by C.M. Coolidge, and it's called A Friend in Need. And even though this painting is, more than 100 years old, we think it does a good job representing the contemporary topic we're talking about, which is the role of telemedicine in the future of animal welfare and the shifting political landscape around veterinary telemedicine. As you might know, the phrase in the cards means that something is likely to happen, and things are happening around telemedicine right now. So in our discussion today, we're going to look into the future where we believe that effective and responsible use of telemedicine will move us closer to fear-free, accessible veterinary care for our animal companions. Slide 2. So this is the group that is joining you today with our much nicer pictures than what you see in person, of course. And slide 3, please. Yes. So this is a kitty, a senior kitty, that demonstrates the type of pet we think that would benefit from better access to telehealth care from the comfort of their own home. And today we're going to talk about what we believe the ASPCA believes about telemedicine, why we believe it, what are the laws, how we're working to change those laws, how you can get involved, and then there'll be time for question and answer. And please do put your questions in the chat and we will try to get to them at the end. Slide 4. So first, we will talk about what we believe at the ASPCA around veterinary medicine. So we believe that telemedicine has the potential to increase access to care, to reduce unnecessary fear, anxiety, and stress, so FAS, and extend the capacity of animal shelters to serve their communities. All of that together should increase and improve animal welfare across the geographic and economic spectrum. Slide 5, please. So basically what we believe is that veterinarians can be trusted to decide when a case is appropriate for telemedicine and when it's not. These are highly skilled, highly educated people, and we believe they can be trusted. So we support the reduction of legal limitations to telemedicine access. And with that, I'm going to turn it over to Jen Hobgood.
Hi, so my name is Jen Hobgood, and I'm with the government relations team at ASPCA. And so right now what we're going to do is we're going to look a bit more closely at why ASPCA believes expanding access to telemedicine holds so much promise for improving animal welfare. The 3 main reasons are that it helps bridge care gaps for owners, reduce unnecessary animal stress, and extend shelter capacity. Yes, there is an animal veterinarian shortage. We hear from some of our colleagues in the Veterinary Medical Association world that that's not true, but there is a documented shortage of veterinarians nationwide. It's becoming a crisis in many areas of veterinary medicine. And if you take a look at this map, if you're not familiar with it, the Veterinary Care Accessibility Project is an excellent resource for looking at access to care at both the state and the county level. So VCAP has taken data from the U.S. Census Bureau, the CDC, and AVMA, and they've come up with an access to care score for those areas throughout the country down to the county level. We know that studies indicate that many pets do not see a veterinarian regularly, often because their owners confront significant barriers to care, whether it's affordability or accessibility due to the shortage. And those obstacles can result in pet owners foregoing care or postponing veterinary visits, or even relinquishing their pets to animal shelters. In 2020, the chief economist for the AVMA estimated that over 50 million pets in the United States, approximately 1/3, do not see a veterinarian at least once a year. And we know that in September 2020, a study by a former University of Florida College of Veterinary Medicine dean, Dr. James Lloyd, found that 75 million pets in the U.S. could be without veterinary care by 2030 if we do not update our approach to providing these services. Telemedicine has the potential to address many common barriers to care. Financial barriers in particular. We know that so many pet owners can't afford veterinary care. And if cost-effective virtual care services are available, and research shows promise here, telemedicine can help address one major barrier to care, and that's cost, which is currently escalating to the point that veterinary care is rapidly becoming a luxury item for so many pet owners. Telemedicine can also help address those ancillary expenses related to, cost of transportation if folks don't have a vehicle, travel time, missed work, and so forth. Telemedicine can help address geographic and logistical problems with bringing pets to the clinic faced by seniors. We know their pets are often a lifeline for them, particularly if they live alone. But higher rates of transportation and mobility difficulties are found within this demographic. And so disabled individuals can benefit from expanded access to telehealth for pets, those lacking transportation, those who face difficulties transporting large dogs or reactive animals to clinics, those spicy dogs, like I have a little spicy terrier in the background here you might hear from momentarily. She's bomb-proof at home, but take her to a vet clinic and take me out of the equation, out of the room, and she has a lot to say to the vet staff, and mostly with their teeth. So spicy cats who don't do well with staff or other animals, or travel-phobic animals, can benefit from expanded access to veterinary telehealth. And especially those who live in underserved urban or rural areas. The availability of vet services in the shortage is becoming a huge problem. We're seeing emergency clinics close or curtail their hours, and folks having to wait days, weeks, sometimes months to get that care that their pet needs. Telemedicine can also address barriers to care for large animals. We know the veterinary shortage is especially acute in rural areas where there are more large animals. Owners of large animals face those geographic, transportation, and financial barriers to care that better access to telemedicine can help overcome. And expanded use of telemedicine technology, we know, can help bridge those gaps in care that are caused by workforce shortages and increase access to the veterinary healthcare system, helping keep pets and people together. We wanted to highlight just a few bits of research. There's so much out there now, and it's really promising. This first, though, is a statistic that's important to keep in mind when we talk about the escalating costs and people's ability to access care for affordability reasons. This is from the Consumer Price Index. That the cost of veterinary services increased almost 11% last year alone. And we know that many pet owners have visited a veterinarian at any time, but only 40% visit a vet annually. The research goes anywhere from 28% to 40%, but this is obviously a huge percentage of the public that is not being served by the current model of care that is reliant on brick and mortar clinics. Access to telemedicine. Now, this next study is from Human Healthcare, but demonstrates that access to telemedicine reduces those cost barriers and place-based disparities. And this last one I find just fascinating. This is a study of over 21,000 virtual consults. And the conclusion was overwhelmingly clear that there were low prescribing rates, and that includes antimicrobials. Treatments were effective, and no harm was done to pets by prescribing remotely via a veterinary consult app. In fact, folks got access to safe, convenient veterinary care. If you look at the last data point there, the last bullet point, you'll see that 99.3% of those prescriptions were green, first-line antibacterials. Very few were yellow, and none were the red. So we sometimes hear in these debates, oh, access to telemedicine, it's going to lead to overprescribing of antimicrobials. But that's just not what data is showing. What it's showing is that it's the same veterinarian in the clinic as over telehealth, and they make judicious decisions about antibiotic stewardship. An ASPCA survey of pet owners that we conducted last year to dig a little deeper into this, our strategy and research department did a survey of pet owners, and we wanted to look at how people are accessing veterinary care. And about 1 in 4 of the people that we surveyed reported there was a time in the past 2 years when they wanted or needed vet care and were not able to access that care. So among those, about 50% said they weren't able to get preventive care. 43% couldn't afford care. 19% said they didn't have a way to. And so what are they doing instead? You might not be surprised. Dr. Google. 30% said they went to the internet to find a way to fix it. 23% said they asked a friend. And 15%, which is not insignificant, said that they gave their pet to a shelter or rescue so they could fix the problem. They severed that bond and surrendered the pet when they weren't able to access care. 47% though said that they were more likely to try telemedicine if they knew if telemedicine services were available and affordable to them. And 40% said they'd see a vet more often. And these are folks we're surveying in 2022 when veterinary telemedicine really still isn't known to most pet owners. So we just kind of asked them about it, and we're getting a very positive reception that it could help expand access to care. Pet health generally, and end-of-life care specifically, can be improved by greater access to telemedicine. Because so many pet owners don't want to cause their pets stress, they delay care, even at the end of life, when we could significantly help these animals with veterinary care. We know that telemedicine can reduce suffering as well as compassion fatigue for veterinarians and staff who are sometimes forced to euthanize animals for economic reasons, or they see these animals at the end of their lives that have gone without care for so long. Telemedicine can also expand access to hospice care. But what I think is interesting about this lap of love, this is an unpublished just inquiry they made through Vet Success. They wanted to look at euthanasias performed in a clinic and see how long has it been since that animal has been seen before euthanasia. 18 months prior, just a year and a half, well over half the cats, 40% of the dogs hadn't been to a clinic. If you look at 12 months, 58%, 44% of dogs, it just gets higher. So animals at the end of life aren't getting the veterinary care they need, and telehealth will open those doors to these animals, especially when owners are concerned about taking their pets in and causing them stress. And I may be preaching to the choir here when we talk about research documenting that clinical veterinary examinations are stressful for most dogs and cats. Fear Free's website has an excellent, extensive research list, but I want to highlight just a couple here. One study found that almost 78% of dogs showed fearful behavior during a standardized clinical examination, with 13% of those so terrified they had to be physically dragged or carried into the exam room. We know dogs that are generally friendly to people can become reactive or extremely fearful when handled by veterinary medical personnel, especially if they're in pain. And oftentimes in a clinic environment, dogs and cats are sometimes separated from their owners for medical exams. And in many cases, that separation results in even greater stress than if the owner remained with the pet. There's a well-known study from 2011, the Bear study revealed that 40% of cat owners hadn't taken their cat to a veterinarian in the past year. And some of the wording in the study was really interesting. The cat owners, and none of you will probably be surprised by this, anyone that owns a cat knows that it is highly stressful for the animals and the people to get cats to the vet. They hide when the carrier appears, aggressively or physically resist being put into the carrier, cry during car or bus ride to the veterinary clinic, show signs of stress and fear in the waiting area, particularly when unfamiliar animals like dogs are present, display physical signs of tension during the examination, and even act remote and unfriendly for several days after returning home. And in that study, cat owners expressed the desire to avoid the difficulties and unpleasantness associated with bringing the cat to the veterinarian. So we know cats aren't getting enough care for those reasons. We love how the veterinary and shelter certification program, Fear Free, has the model taking the pet out of petrified. And one of the key tactics that Fear Free emphasizes is the use of pre-visit pharmaceuticals administered at home prior to coming to the clinic to prevent that anxiety and fear and stress. And that sort of a best practice is not available under laws that require a veterinarian to put hands on the animal before that animal has access to remote prescribing. We believe that when a veterinarian feels they can safely diagnose and treat an animal based on a telehealth examination, it can spare anxious pets the unnecessary stress of a clinic visit. This is a really interesting study from January 2023. It was funded in part by the ASPCA. This was a UC Davis study where researchers found that cats showed signs of increased stress in office appointments. In-home appointments better reflected the health and behavior of cats. And they found and concluded that telemedicine could be effective for routine consults or in rural areas with little access to care. The researchers, what they did was documented pupil dilation, respiratory rate, lip licking, and ear position. In these home sessions, participants would lift the cats for visual inspection and they would count the breaths. All appointments were recorded and photos of the cat's eyes were taken, as you can see here, to measure the pupils. The research found that cats took more breaths, had larger pupil dilation, and more negative ear positions during the in-person examinations as compared to the home assessments, which of course indicates increased stress and arousal in the clinic setting. And this is a quote from one of the researchers. These results support the idea that video appointments could help reduce stress surrounding veterinary appointments in cats. And they found in-home assessments could better reflect the health and behavior issues because cats, of course, are both predator and prey. They don't want to show their vulnerabilities. They might be sick and acting like nothing is wrong in a clinic, whereas being comfortable in their home environment can better reflect how a cat is feeling or if they're in pain. So for these fearful pets whose owners may postpone those clinic visits out of a desire to not subject their pet to undue stress, telemedicine can provide more options from care to be accessed from the pet's comfortable home environment or for mitigating that fear and stress when they have to be transported to a clinic. Quality of life assessment, palliative care, and end of life or hospice care provided through veterinary telemedicine technologies have the potential to reduce those unnecessary clinic visits, minimize stress, and lessen animal suffering, especially for senior or terminal animal patients. So in this next section, we want to briefly go over the benefits to animal sheltering of veterinary telemedicine. We do know that, many people, when the subject comes up, they say, well, the animal shelter owns the animals in their care. That is not always the case, depending on state law. California has a particularly thorny law about this, but they don't own all the animals in their care. They don't own the stray holds. The veterinarians do make medically appropriate and timely visits to the premises, but this is a gray area of law. It's very murky for certain animals, whether or not the veterinarian can treat them, depending on the legal status. So what we want to look at first is a study out of California, and then we'll get to the benefits. We want to look at part of the problem that we're seeing in shelter medicine. This is one of the areas where the shortage is so acute. So out of this recent survey among California shelters conducted by the San Francisco ASPCA in partnership with some other folks, UC Davis and so forth, found that of the shelters that had budgeted vets and vet techs, more than 50% were remaining vacant due to the lack of candidates. Over 2/3, 68% of the shelters cannot consistently provide care to treat conditions commonly seen in shelters. And this is a quote from the study survey, and I think it's so important to read it because of what we find out here. Survey respondents agree that a lack of access to veterinary care has numerous downstream effects. Notably, nearly 80% of respondents identify that increased length of stay results from inadequate access to vet care. And that increases the cost to house animals, strongly contributes to behavioral degeneration in the shelter, and increases the number of animals that staff need to care for at any given time. Other major downstream effects include inability to provide intake prevention programs, limitations on adoption programs, and limitations on community cat programs. And the study authors say these programs are all pillars of a modern approach to community animal care. Therefore, a lack of access to care hinders organizations' abilities to meet current best practices in animal sheltering. And this is a graphic that we developed at ASPCA to kind of demonstrate this problem. It's a cycle. So we have unmet needs in the community, unmet medical needs, leading to longer lengths of stay in the shelter environment, which, of course, to make those sick animals healthier, it takes longer. So that's leading to larger shelter populations, which, of course, leads to a reduced capacity for care and can contribute to unmet needs in the community. So it's a cycle that expanding access to care, such as telemedicine, can help us disrupt in the field. Except for stray holds, we know shelters typically own the animals and they make those timely visits to the premises, but animal shelters need the flexibility to use telemedicine because of this can be such a gray area of law. Animals in the custody of shelter programs who need veterinary care, like potentially owned animals who are currently lost, or animals in foster homes that are not owned by the shelter, but are the pets of the foster parent, stand to benefit directly and indirectly from expanded access to telemedicine. So shelters benefit in a number of ways. First of all, animal shelters with veterinarians on staff can face situations where these veterinarians can't be on the premises, but can still be able to provide care through telemedicine. And for animal shelters without veterinarians on staff, life-saving services can be provided through telemedicine by third-party veterinarians. And community cats raise a whole host of questions, like who's the owner? How do we adapt these herd health concepts? You can't perform an in-person exam on a feral cat every year without major intervention here. Most private practices don't accept feral cats as patients. So how can telemedicine help us serve that population in particular? And of course, health equity. We want to give all patients the care they need when they need it. They deserve it. And if more than one third of pets in our communities don't regularly see a veterinarian, this can stretch shelter resources. One last fact here, a national study showed that 40% of low-income owners who rehome their pet reported that access to affordable vet care would have helped them keep their pets. So we can keep those animals in homes and out of animal shelters. And that, of course, protects our animal sheltering facilities. Also, animal sheltering facilities that operate clinics that are open to the public can increase their community's access to care through telemedicine, offering different services, quality of life assessments, and treatments for routine conditions that can help keep animals in homes and out of shelters and can help prevent disease spread and conserve shelters' limited resources. And that's why we're seeing groups like the Association of Shelter Veterinarians coming up with a very strong telemedicine position statement. You can find this on their website, and I won't read it, but they have a very similar policy to the ASPCA's, which is that veterinarians at their discretion should be enabled to create new patient relationships over telemedicine. Same for the Association of Animal Welfare Advancement. You can find both of these position statements on the web, so I won't belabor this point, but both of these groups support new patient relationships over telemedicine, which are currently blocked in many states. So now that brings us to the policy. Where are we and where can we go from here? Right now, where we are is that many laws unnecessarily constrain veterinary telemedicine. So we're going to look at where we are now and where we can go. Historically, some physicians resisted emergent telemedicine expansion for similar reasons that we're hearing in legislatures across the country. Nowadays, they claimed back then that the laying on of hands was absolutely vital to any proper diagnosis and treatment. For many years, there were some physicians who felt that way, but as all the way back to the early 90s, that's not been the case. Resistance in human medicine pretty much evaporated in the early 90s to telemedicine. So in all 50 states, human providers can create, and not just doctors, not just physicians, but nurse practitioners and so forth in many states can also create new patient relationships over telehealth, but certainly physicians can. And human telehealth really recognizes that in-person physical examinations may not be necessary in many cases, that telemedicine can expand access to healthcare and offer people a convenient, safe way to stay more connected with care and keep sick people out of waiting rooms when it's not necessary. And that includes for all human patients, babies and other nonverbal people in all 50 states. Physicians can establish relationships with these patients to deliver better care. I love this ad in the most recent Stanford magazine that says, Whether you are a first-time or established patient, a video visit can be appropriate for both primary and specialty care appointments to diagnose and treat many conditions. We have figured it out in human healthcare, and veterinarians need to have this capacity as well. But what is blocking it? This right here. You didn't hear a lot about this until recent years, right? The VCPR, what is that? The debate about veterinary telemedicine centers around a component of legal practice that's long been settled in human healthcare, the flexibility of the healthcare provider to establish a new patient relationship over telemedicine. In veterinary medicine, many state and federal laws, though, have an outdated laying on of hands ideology hardwired into their laws. So the correlation, of course, to the doctor-patient relationship, the physician-patient relationship, is the veterinarian client-patient relationship, or VCPR. And the sometimes decades-old federal and state laws requiring a recent examination, sometimes within 12 months, for a valid VCPR. And this remains the AVMA's model policy, that a veterinary VCPR cannot be established electronically. So we're at a pivotal point where we need to update these laws. And first, we want to look at the federal regulations, because sometimes in lobbying this issue, we hear the federal laws prohibit establishing a VCPR over telemedicine. Can't do it. That's misleading at best, and at worst, an outright lie. At the federal level, only 2 provisions require a VCPR, and that's the USDA's regulations relating to extra-label drug prescribing, which is a significant amount of prescribing in the veterinary world as well, and veterinary fee directives. And what the regulation says here is that you have to have a valid VCPR, and that can only exist when the veterinarian, you can hear my, I don't know if you can hear my vicious attack toy poodle in the background, that the VCPR can only exist when the veterinarian has recently seen and is personally acquainted with the keeping and care of the animal by virtue of an examination of the animal and or by medically appropriate and timely visits to the premises. That latter part is for herd health, for farms primarily. So that's the extra label drug regulation, and a similar one is used in the veterinary fee directives language. Those federal regulations are, they were enacted with the Animal Medical Drug Use Clarification Act in the 90s, at least the extra label drug regulation was, and with veterinary fee directives, it was just repeated a little bit later when that was enacted. They're decades old, at least the extra label is, but in 2023, when the FDA withdrew its temporary enforcement waiver, where, during COVID, the FDA wanted to make sure we could maximum use of telemedicine could be enabled, and that laws weren't getting in the way of that. They said, we're not going to be enforcing those federal VCPR rules because we want people to be able to use telemedicine. But when they withdrew that guidance, they did say, even though the rule doesn't specify physical, they said the federal VCPR definition cannot be met solely through telemedicine. So for those 2 situations, veterinary fee directives, extra label drug use, you need a physical examination. But those laws were enacted when our technology wasn't nearly as advanced and looked a little bit something like this. So I think you could probably guess what world event catapulted veterinary telemedicine to the forefront of our policy discussions. The COVID-19 pandemic, of course. So other than the extra label drug prescribing and VFDs, the veterinary fee directives, state laws govern the practice of veterinary medicine within each state, and that includes the VCPR. Most state laws require veterinarians to establish a VCPR or obtain sufficient knowledge of a patient before they can legally practice veterinary medicine or treat an animal patient. But this landscape is changing. The definition of telemedicine for the purposes of this map, it's a kind of in fine print, but this is to demonstrate the lack of discretion in the law. Once a veterinarian has that in-person VCPR, they can use telemedicine, but they can't at their discretion with new patients. So what you see here is what it looks like in veterinary medicine right now. Most states don't enable veterinarians to have discretion over that choice, though it is changing, which is what we're going to talk about here in a second. Just real quick, you see that on the support side, a number of organizations, but don't let this look lopsided. The AVMA is on the other side, and the AVMA-sponsored Coalition for Connected Veterinary Care includes a large number of that state VMAs and some other national groups. So it is a divided industry right now. And what we are seeing is that some of the recent legislation is not to expand access to telemedicine, but contain it with an in-person VCPR requirement. So we have to ask the question, is this kind of stacking the deck here in some way? So if we look at the legislation that passed in recent years to require a physical exam or prohibit a telemedicine VCPR, this is what it looks like. The red states would be those states. And California has changed, which you'll hear about momentarily, but California's law prohibited veterinarians from establishing a VCPR and then seeing that patient again within 12 months for something else. They had to reestablish the VCPR through a physical examination for each medical condition. And the West Virginia bill that passed mandated a face-to-face, that even had these words in it, in-person examination of the patient within 12 months. So I want you to remember this map, because I think you're going to see it's changing. But the question is, in a post-pandemic world where telemedicine is a proven effective tool for expanding access to care, why are some folks doubling down to require a physical examination before a veterinarian can treat a patient? And we know a bluff is like it's a bet that you make with a weak hand, hoping your opponent will fold a stronger hand. And a tell is an unconscious indication from your opponent that he has a certain type of hand. So I think if you look at this, it speaks to what one veterinarian, Dr. Patty Cooley, says is, that it's almost like political subterfuge. We're saying, oh, it's about quality of care. Oh, it's about animals can't talk. When really, she says, is this a genuine ethical argument about quality of care, or is it disingenuously fabricated to serve a protectionist position favoring brick and mortar medicine? Is the limitation based on the ability to speak a specious argument in service of the status quo? So what you see now, the maps are starting to look different. There's an uptick in some more progressive, forward-thinking legislation that looks at expanding access to telemedicine. So in 2023, this is what the map looks like. You can think green means go, red means stop. In Alaska and Illinois, there was legislation to require an in-person exam, prohibit telemedicine, VCPR. But in the other states, progressive legislation. And in Florida, there was one of each filed in 2023. And then this is what it looks like this year. In Colorado, we have competing proposals, but in many other states, progressive legislation. New Jersey, who has a really great law, for some reason there's a legislation that would repeal veterinarians' ability to establish a VCPR virtually. I just wanted to quickly look at, in Arizona last year, we had a victory for incremental progress on veterinary telemedicine. It's a veterinary virtual VCPR, but there were limitations on prescribing, so 14-day duration of a prescription with one refill with another telehealth exam, and then after that, patients would have to come in for additional refills. In New York doesn't have a VCPR in law or regulation. They have guidelines that the Veterinary Medical Board has issued. Those don't have the force of law, so there's both legislation and potentially pending regulation in New York for legal clarification on veterinary telemedicine. In Florida, we have a bill going through the legislature right now called the PETS Act, Providing Equity in Telehealth Services. It has unanimously passed the House of Representatives and is in its second Senate committee with the legislature slated to adjourn March 8th. And then in Michigan, we don't know where the coming or going on telemedicine. At first, Michigan had a great rule that they enacted, and it was in place for about a year before the board got pressure from the state VMA to repeal it. And now there's progressive legislation that's been filed at the Capitol in Michigan. So that's where we're at in those states. And now I'd like to hand it off to Brittany briefly to look at California and what's happening out west.
Thanks so much, Jen. All right, so we had a very exciting 2023 in California. As some of you are likely aware, and as Jen just mentioned, prior to this year, California had some of the country's most restrictive rules regarding telemedicine and the VCPR. Not only was an in-person exam required to establish a relationship, but the VCPR had to be reestablished via another in-person exam for each new ailment. This created a significant challenge for pet owners and vets alike amidst the access to care crisis, not to mention a hardship for the pets who get fearful, anxious, or stressed going to a clinic. So what did the California bill do? As of January 1st, California now allows veterinarians to establish their VCPR using synchronous video. So basically a FaceTime or a Zoom call or other similar technology. Once the VCPR has been established, treatment can be maintained using other modes of telemedicine, such as a phone call. The law allows for 6-month prescription durations for most prescriptions, which can be renewed via another video exam or, of course, an in-person exam as needed. The law prohibits the prescribing of controlled substances using telemedicine and follows federal law regarding extra label and food directives, and limits any antibiotic prescription to 14 days. This was a big change or a big amendment that we took at the end, realizing that, as has been discussed a bit in the chat today, that any antibiotic that isn't working by 14 days, that animal needs an in-person exam. One of the areas most discussed, including the antibiotic provision around the development and advocacy of this bill, was establishing appropriate guardrails to ensure that the same standards of care are met as seen in an in-person appointment. So the guardrails in California include requirements for in-state licensure. So a vet practicing telemedicine on a patient in California has to be licensed in California, that they be able to provide a list of local clinics in case an in-person exam is needed and that vet is not available to conduct it, and that the veterinarian provide information about telemedicine and obtain informed consent from the client before any telemedicine exam occurs. I'm happy to share that with these requirements unique to California, the State Veterinary Medical Board ultimately supported the bill, which felt like a huge win for us mired in this battle. And we passed the legislature with a nearly unanimous vote. California veterinarians and pet owners alike can now utilize this key tool in the Access to Care Toolkit. Next slide, please. And while California may have appeared from the outside as a pretty smooth path to telemedicine, it was, as I mentioned, a battle, and one that has spread to 2 other Western states this year. In Colorado, after 2 years of trying to find common ground, a bill is moving through the legislature that would entrench in statute the requirement for an in-person exam to be established to establish a VCPR. This is problematic for the many reasons we've discussed so far today, at a time when people are struggling to access in-person appointments and when logistical and financial challenges make an in-person exam a barrier to care. We should instead be trusting veterinarians to determine whether an in-person exam is needed rather than further limiting their options. So this is a bill that we are working to stop this year. And one of the ways that we are doing that is by running a ballot initiative with local partners for the November ballot that would expand telemedicine and allow for a virtual VCPR. This is pretty exciting. Keating Research actually conducted polling of Colorado voters and found that by wide margins, voters support allowing vets to use telemedicine at their discretion, including during initial visits. 72% of respondents said that they would support the measure, with only 8% reporting that they would oppose it. We are gearing up for signature gathering on this measure, which has been approved by the title board as Initiative 144. So you can find more information by searching Initiative 144. We'll talk about getting involved a little bit more later in the presentation, but we really hope that you'll join us in Colorado and getting the word out. And then over in Washington, the State Vet Board has actually been considering a rule change since the COVID exemptions allowing for a virtual VCPR. Over the last couple of years, the board has been pretty evenly split on this issue, however, so we are working with lawmakers there to introduce a pro-telemedicine bill. Unsurprisingly, as we've seen in other states, the Washington Veterinary Medical Association is opposed to a virtual VCPR. So we are working with our partners in the legislature and kicking off a working group in Olympia this week to see where we can find some common ground and what a bill might look like. This week is going to be the first meeting of many, so if there are any Washingtonians on the call interested in being a part of those discussions, we'd love to hear from you. And that's where the state legislation is at in our Western Division. I'll kick it back to Jen and Dr. DeClementi to go over some case studies with you all. Thank you so much.
Yeah, so now that you've heard what the states look like, we'd like to demonstrate how this varies from state to state with a couple of case studies. So first I'll introduce each case, and then Dr. DeClementi will talk about the medical aspects, the potential treatments for these animals. So the first one, and a shout out to Dr. Brian DeGangi. We've given similar presentations in the past, and this is one of the photos and case studies that Dr. DeGangi created originally. So this is fleas. The patient is a 5-month-old intact female puppy with you know, you don't need to be a veterinarian probably to look at this animal and see what's wrong, but a veterinarian surely could, especially over telehealth as well as in person. This dog has a flea infestation and lived outdoors in her former home. The client, because it's important that we think about when we do this, not just what's best for the veterinarian, but what's best for the patient and the client as well. So the client acquired this dog from a neighbor. They've never had a pet before, first-time pet owner. The first veterinary appointment they could get is 3 weeks away. So they have an appointment, but they don't know what to do right now. And they live in an area, like I live in Tallahassee, where, you know, the over-the-counter stuff just does not cut it. You're going to have fleas in your house if that's what you try to rely on. So she loves to sleep with my kids, but scratches nonstop. Doc, what can I do? So here's what she could do. Camille, you want to take this one?
Yes, thank you. So in this particular case, we were trying to point out what would happen or what's legal in different states. So in Arizona, under the new law there, the virtual VCPR is permitted, and they can make a prescription up to 14 days. So we can't prescribe anything that would last longer than 14 days. So on-label usage in this case would be Capstar. So this dog could receive Capstar, which would provide some help. In Illinois, there are no virtual VCPR options. And so in that case, they would probably have to find another veterinarian who might be able to see them if they can get in anytime before 3 weeks. That would be a more difficult space. And then in Idaho, because they allow a virtual VCPR, that veterinarian could prescribe Bravecto, which is a longer lasting product, more than 14 days. So that's how it plays out in an actual case.
And then the second case study that we have, this actually also came from Lap of Love, and Dr. DeGangi brought this over from Dr. Danny McBetty. So this is in this case, compassionate care case study, a 15-year-old neutered male lab mix, 85 pounds, with advanced arthritis. This patient has difficulty getting up and down, panting and pacing at night, but until recently has been doing pretty well. Hates going to the veterinarian, so the pet has not been to see a veterinarian in at least 18 months. Over the years, he's had arthritis a long time. He has had arthritis a long time. So when the family could afford it, they might take him in and get some medication, and so they know what worked in the past. But this animal hasn't been to a vet clinic in a long time because so stressed out about going to the vet. The client is an older woman with physical limitations. They don't have a veterinarian. The spouse is away on a business trip, and this is the spouse's baby. And so the client says, I just want to keep him comfortable until my husband can come home and we can say goodbye together. I don't want to try to haul this dog into a clinic just to get some comfort, but the dog is very uncomfortable and at the end of life. So what can we do, Doc?
So this is another one where it would depend on where they are. So if they lived in Louisiana, the laws there state personally acquainted and recently seen, but we know that this dog hasn't been into a veterinary practice for multiple years. So in that situation, could the veterinarian use a photo or video to become personally acquainted and recently seen? And that would be up to them, but knowing that the board might interpret that law differently. In Mississippi, there is no virtual VCPR, so there is no option. You know, any veterinarian in that state would not be able to help this dog out without an in-person situation. And in Virginia, a virtual VCPR is permitted, so using an on-label drug for this dog, carprofen would be an option.
And now we'll hand it over to Amy, who's going to talk about how you can get involved.
Thank you so much, Dr. DeClementi, Jen, Brittany, and thank you to Dr. Merlot, the Fear Free team, for hosting this webinar today. And thanks to everyone who's joining us. We know you're all super busy, and we really appreciate your time and interest. And I'm absolutely loving the active conversation in the chat. Thanks for that. So you've heard all about the veterinary telemedicine that's going on, the good, the bad, the legislation. There's a lot happening. So how can you help? I hear all the time from people that they would love to get involved, but have absolutely no idea where to start. And it's super common, and the legislative process can be unnecessarily confusing. But that's what my team, the ASPCA Legislative Engagement Team, is here for. And I'm so excited to tell you that it is really easy. It's much easier than you think to get involved. So I know we have many folks joining us today who are experts in your field, veterinarians, shelter and rescue leadership, and so on. But I would bet there's a wide variety of policy experience here in the audience. So bear with me if you're seasoned in the policy space. But let's just start with a quick and really important 101. So how do you know who your legislators are? The ASPCA has a really awesome tool. It's aspca.org/lookup. You can see that link right at the bottom of this slide. And you just type in your address, and what it'll do is generate all of your legislators from the very local level all the way up to your federal representatives. And once you have that information, you'll be able to connect with your legislators. And this is super important because your legislators do need to hear from you. They need to hear from the people they're representing to know what their constituents care about. And I could go on and on about how much of an impact it makes for your representatives to hear from you. But for the sake of time, and I know we have a Q&A right at the end, I'll just say that your voice is absolutely critical. So we'll go on to the actions that you can take. There's something for everyone, regardless of experience level, with legislation. So we have quick and easy actions like a letter to the editor in your local publication. Our team can help you with that. It's actually one of the first actions that I took as far as legislative advocacy, and I heard back from my legislators saying that they were going to co-sponsor a bill. This was years ago, but it was very validating, and I have to say it's fairly easy and not very time consuming. So like I said, we're happy to help you if you want to get involved that way. You can write a letter to your legislator. You can meet with your elected officials. Those things we can certainly help you out with. If you've never done it before, we can help facilitate that. And so something we're always looking for is field experts like veterinarians or people with lived experience related to veterinary telemedicine to testify in hearings. In Florida, that looks like attending the hearing in person to testify, which is not as convenient, but it's really impactful when it does happen. And in other states like Colorado, the options to testify remotely or submit written testimony are available. So it's much more convenient in states like that. If you're in Florida or Colorado specifically and interested in contributing testimony, please reach out to me at the end of this webinar. And if you're a veterinarian or vet tech, tell AVMA and NVTA and your state VMA that you support a virtual VCPR. And lastly, we oftentimes circulate coalition letters to demonstrate support, and we would absolutely love for any veterinarians on this call to join those letters. And we'll tell you how you can stay in touch on the next slide. So if you don't mind advancing that slide. So how can you stay looped in after this webinar? If you're a veterinary professional, and this includes students, we recently launched a brand new veterinary policy committee that we call the Veterinary Engagement Team, or VET for short. There's no time commitment required whatsoever. We recognize how busy you all are, but it's a really great way to stay up to date on calls to action in your state and get involved. And we'll share updates and actions you can take that will take 2 minutes from the comfort of your home all the way to asking for testimony. And the great thing is that it's just designed to accommodate any schedule and any experience level. So you can go to aspca.org/vet advocates to sign up for that. And if you're not a veterinary professional, that's okay. Join the advocacy brigade to stay up to date on legislation and calls to action. And that is right at the bottom of the screen. I think it's a little bit small, but you can go to that link and sign up to get updates on our legislation and stay involved there. And anyone from the following states, if you're in Florida, if you're in Washington, if you're in Colorado, Michigan, or New Jersey, you heard about legislation happening in those states, and we really, really need your involvement. So I would highly encourage, if you're from those states, reach out to me, join the vet engagement team, join the advocacy brigade. We really want to hear from you. That's happening right now. And so as a mom of 2 large young dogs who are a complete handful at the vet, if you know my dogs, you know what I'm talking about. But I can say I've already experienced the great benefits of veterinary telemedicine, and we're super excited to work with all of you to help get this important legislation passed.